The transformation to the Wilmot Cancer Institute reflects the fact that this is really more than just one building.
The word institute implies that we have a network which is far-reaching. It integrates science and clinical care.
There's a close proximity between the physicians caring for patients and the researchers.
We're going to have offices spanning from Geneva all the way to Brockport and perhaps beyond.
A patient can be seen here, get what they need from the here, but then go back closer to home and get their daily radiation treatments.
People outside of this area, they don't like to come to the big city of Rochester. They like to stay in their own little towns, and now we can go out, we can reach them.
We're the only cancer center with a research focus, and we by far have the largest clinical trials network.
Without research, there simply wouldn't be any clinical care, and there would not be any progress in clinical care.
I think it's inspirational to watch these individuals work and to appreciate what they know and what they're hoping to achieve.
That's a great feeling to come across a new discovery. You're excited like a young kid at the candy store.
Having a research program in place, in my mind, means that you're going to get the highest level of patient care as well.
We're not too big that we lose sight of what's important, which is patient care, but we're big enough that we're able to do the research. We're able to get the newest treatments.
I want to see us continue to grow and become a nationally and internationally recognized center where important research discoveries are made every day that are impacting patients directly.
Precision medicine is really the future of cancer care, and the Wilmot Cancer Institute is really at the frontier of this new endeavor.
Precision medicine is like getting a fingerprint of the genetic material of an individual.
We are finding interventions at the molecular scale that can be targeted with treatments.
Not every cancer can be treated by the book. And you can't tell when you go in whether your cancer is going to be that kind or not.
We're able to classify those tumors and provide information that will allow a more precise tailoring of the treatment.
This type of what we call precision medicine approach has absolutely changed outcomes for patients.
Our patients do better. They do better in terms of outcomes. They do better in terms of side effects. They have better survivorship.
I think that what people in the Rochester region don't realize is that we have national experts right here at University of Rochester in many different types of cancers.
They're committed, they're smart, they're energetic, and they're curious about how we can make things better.
Our doctors, once they become our faculty, it is almost like they never leave because they enjoy the stimulating environment.
They really love the job they do. They're really smart people and they're really good collaborators.
It's not as if you're calling up a consultant, you're calling up your friend who happens to be a lung doctor or a radiation doctor.
There's really not a single person that I wouldn't send a family member to.
Coming from Mayo Clinic, where patient was supposed to be the center of care, it's impressive to realize how well they do it here.
The feeling of seeing a patient do well and be with their family and knowing that you had a small part of that is really what helps keep us going day to day.
It puts a sense of joy and enlightenment and fulfillment in my heart that I don't think any other experience in the world could ever provide.
I love taking care of cancer patients. You just get back so much more than you give.
You're not just taking care of a random face that appears in the hospital every day. You're taking care of your neighbor. You're taking care of your friends.
Going through this, I feel so humbled that I am permitted to even get to know them.
They come to you as the most vulnerable part of their life. It's really a privilege for me to take care of all my patients.
We can offer them hope. We can offer them potential cure, and that's really why you go into medicine, is to be able to help people when maybe nobody else could help them.
So they become like family, and they will tell you that. It's a family that they may never have wanted, but nonetheless, they're family.
I can't imagine a job that I would love more than this job.
The privilege that we have to be allowed into their lives at the most vulnerable point is amazing.
In some ways, I am everyone's worst nightmare. Suddenly you're sitting in my office for the first time and we're going to have a discussion that is horrifying. Conveying to people that this is bad, but there's hope, and we're going to do everything, and no matter what, you're not alone going through this. That's why we became doctors, and that's why we do what we do.